Hello, my name is Helen McMillan and I am the Personalised Care Lead for a GP federation in Northampton called General Practice Alliance. Today I'm going to talk to you about the personalised care agenda and what we've been doing in Northampton for the last 3 years to develop personalised care locally. So today I'm going to talk you through an overview of what personalised care is, why we need it, and the evidence of that need. And then I will go into the 6 components of personalised care and talk about the progress we've made in each of those areas. We'll talk about the infrastructure behind the personalised care programme of work that has enabled it to become the success that it is today. And we would then like to gain some feedback around how we could expand on the work we are doing and explore the future potential of personalised care. Personalised care simply means that patients have more control and choice when it comes to the way their care is planned and delivered, taking into account individual needs, preferences, and circumstances. Ultimately, people want to be treated as a whole person by professionals they trust, to be involved in the decisions about their health and care, to be supported to manage their own health and well-being, and feel their care is coordinated so they only need to tell their story once. Healthcare practitioners and organisations across the country are increasingly recognising the benefits of personalised care and are working to empower patients to become advocates for their own care plans by developing their knowledge, skills, tools, confidence, and motivation. The evidence base for personalised care continues to grow, demonstrating a positive impact on people, the system, and professionals. And this has led to increased patient and clinician satisfaction and more effective use of healthcare services. It also recognises that people's health is impacted by many different factors, and supporting people to better manage their health cannot be achieved without considering all of the contributing factors. And this includes socioeconomic factors, our physical environment, and our health behaviours, as well as the access that we have to our healthcare services. So the personalised care agenda comprises of 6 components, and all of these 6 components are all about supporting people to increase their knowledge, skills, confidence to better manage their health and well-being. Component 1, shared decision-making. So if we start with component 1, shared decision-making, this allows individuals to receive the expert advice and support they need in order to make the right decisions for their own personal health care. Treatment options, potential risks and benefits can all be discussed alongside the patient's goals, values and beliefs to outline the best plan for that person. The process of shared decision-making enhances the overall experience due to the patient being actively involved and therefore invested in the decision-making process. Shared decision-making between people and clinicians about their tests, treatment and support options leads to more realistic expectations, a better match between individuals' values and treatment choices, and fewer unnecessary interventions. The research says that when shared decision-making is implemented, there have been demonstrable improvements in specific health indicators. People with long-term health conditions feel more confident to manage their health, have fewer GP contacts and fewer emergency admissions than people with less confidence. And the research has also identified that peer support can help people feel more knowledgeable, confident and happy and less isolated and alone in managing their health condition. Group consultations are a form of shared decision-making in a peer group environment. They provide an opportunity for expert clinical advice alongside peer support. When group consultations are implemented, they can replace one-to-one consultations, thereby freeing up clinical time and improving access to a clinician. And the evidence highlights improved patient satisfaction. Over the last 3 years, GPA, the Personalised Care team, have been working closely with our practices to implement group consultations. It is a new way of working and there have been challenges. Although GP practices recognise the benefits, surgery staff lack the capacity and confidence to facilitate groups. It became apparent that we needed to find a more sustainable solution to implementing group consultations locally. The personalised care teams and wider services employed by GPA are designed to provide extra capacity within primary care. We've recently recruited a specialist care coordinator to provide the administrative support and coordinate the pathway into the service. Our social prescribers and health coaches are facilitating the sessions, and our clinical pharmacists are providing the clinical capacity, thereby providing sustainable delivery of group consultations for our member practices. In recognition of the value of peer groups in enabling people to build their skills, knowledge and confidence to make positive lifestyle changes, our Spring Social Prescribing Service has set up and delivers diabetes peer groups across the borough in collaboration with our GP practices. To ensure sustainability of these groups, we have partnered with Diabetes UK, who train peer leaders to facilitate the groups after an initial 6-week programme delivered by the Spring Link workers. These have been running for over a year, and the groups have been very successful, demonstrated by the ongoing positive impact from participants and the member practices who have partnered with the Spring Service to provide this additional support for patients with diabetes. More recently, Spring have worked in collaboration with Dr. Mike Scanlan and Susie Dion, who deliver a chronic pain webinar to develop a chronic pain peer support pathway. Often people feel alone with their pain and value being with others who are experiencing similar issues and concerns. By providing a wraparound peer support group, Spring have provided a more sustainable forum for people living with chronic pain to embed the skills learned in the chronic pain webinars, share successes and encourage behaviour change. Component 2. Personalised care and support planning. This starts with an initial integrated assessment of the individual's priorities and then moves through a series of facilitated conversations between the person or someone who's close to them and their health and care professionals, where they discuss and explore the management of their health and well-being in the context of their personal situation. Skills and strengths will be recognised as well as the things that matter most to them. This process also addresses things that may not be working in a person's life and identifies specific actions to resolve these. The process ensures that people received a joined-up holistic plan that takes everything into consideration and suits their health and well-being needs. Empowering people to become active participants in the planning and management of their own health and well-being allows outcomes and solutions to have the most impact in their lives, meaning there are improved chances of people successfully engaging in their treatment plans. Care coordinators are an additional primary care role designed to work with people on their personalised care and support plans. They help people to navigate their way through the health and social care system and coordinate personalised and joined-up care. Streamlining the process by integrating health and social care at the point of assessment and planning means a person can avoid repeating their situation time and time again. They will have one assessment and planning experience that results in a single integrated personalised care and support plan, telling their story only once. The value of the care coordinator role lies in its versatility and the potential to address local needs through specialisms. Our ARC care coordinator primarily works with people over 65 who have been discharged from hospital or who have complex health and social care needs. She works tirelessly to ensure patients have all the right support in place. Over the last 3 years, she's worked hard to provide a quality service and is a valued and well-respected member of both the personalised care team and the surgery she works on behalf of. More recently, we've employed a Grand Union care coordinator. Work streams will include coordination of group consultations, cancer care reviews, and proactive outreach to patients who frequently attend surgeries. A cancer care review gives patients the opportunity to have a discussion and enables them to flag any concerns they may have about their experiences around diagnosis and treatment. Cancer care reviews should be patient-led and can help identify what support is available to them. With the addition of our Grand Union Care Coordinator, we have an opportunity to support people with early diagnosis of cancer to access local groups and services to support them to focus on their health and well-being. Our care coordinator will work in collaboration with our health coaches, social prescribers and wider services to deliver a comprehensive package of psychosocial support. The intention is for people to have access to a wide range of services that are not specifically cancer focused, which will enable people to find support and build a happier lifestyle with and beyond cancer. Our personalised care services can help to identify and address unmet social needs and health inequalities through targeted work with specific groups identified through proactive approaches. Focusing on individuals' wider health and well-being and supporting them to stay well can free up clinical time and capacity, avoiding the need for A&E attendances and unplanned admissions. In recognition of this, we have recently been working with Leicester Terrace Healthcare Centre on a pilot project with frequent attenders at surgery, with the aim of reducing healthcare usage, improving health and well-being of participants, and improving joined-up working between services by creating a pathway of support. It is important to ensure that people are telling their story once by creating a personalised plan for a more cohesive experience. With the support of our new care coordinator completing personalised care and support plans, we aim to roll out our frequent attenders project to the 4 other Grand Union surgeries. Component 3, patient choice. Patient choice is designed to ensure that patients are aware of their options and can, where possible and appropriate, select providers and services that meet their individual needs. When health and care professionals are aware of and support people in exercising choices available to them and have good quality information to help individuals make the best decision for them, this will give patients a greater opportunity to benefit. It includes making sure that suitable alternatives are offered if people are unable to access services within the national waiting time standards. In recognition of the wider determinants of health, GPA have designed a local directory of services to enable patient choice. Our Wellbeing Launchpad is designed to support patients to be referred into local community assets and access resources, enabling people to self-manage effectively. It was co-produced with our link workers and designed to provide much-needed resource to enable our staff to refer and signpost to a wide range of available services in their local communities. Resources are vetted through our governance committee to provide quality assurance. Our personalised care administrator works behind the scenes to keep the directory current and up to date. She also engages with community services and end users to enhance the platform and improve its functionality. Volunteering can provide people with an opportunity to gain a sense of purpose, belonging, and can improve well-being. GPA have designed the Volunteer Passport to provide patients in Northamptonshire with more choice and opportunities for volunteering. Since its introduction, over 500 volunteers have logged over 3,000 hours of volunteering locally. Here at GPA, we value the well-being of our communities and champion the Feeling Good app. We have purchased licenses so that everybody in Northamptonshire can download this app and use it for free. We have been working hard to empower our communities to better manage their health and well-being. Our personalised care services collectively identify local needs and gaps in service provision and work to meet those needs and enhance patient choice through the many different work streams and projects we deliver, in partnership with our primary care colleagues, local communities, and the people we work with. Component 4, social prescribing. Through partnering with a link worker, people can focus on what really matters to them as an individual, whilst also becoming connected with community groups that provide practical and emotional support, helping patients to improve their health and well-being and their social welfare. Social prescribing link workers also support existing community groups to be accessible and sustainable and help people to start new groups, working collaboratively with all local partners. Social prescribing is an all-age, whole-population approach that works particularly well for people who have one or more long-term health conditions, who need support with low-level mental health issues, who are lonely or isolated, or who have complex social needs which affect their well-being. Social prescribing aims to address the social determinants of health, the 40% of what makes us healthy. There is lots of new and emerging evidence around the value of social prescribing. GPA currently employs 2 social prescribing teams. The Additional Roles Reimbursement Scheme funds our primary care network social prescribing service, which currently supports the employment of 9 link workers who cover 13 local surgeries. This gives you a picture of the capacity the service has been delivering at over the last 6 months. As you can see, referrals into the service have been consistently high, demonstrating the benefits of link workers working within practices and building reputation over time. Our social prescribing service uses the Wellbeing Star to measure individual progress on the journey of change. People who've engaged in the service have demonstrated average improvement scores of 10.31 in total, or 1.29 per domain on their journey of change. 91% of people have made progress, and 71% of people have made progress in 3 or more outcome areas. People need to be in the right frame of mind for making changes in their lives. Even when patients do not engage in the service, we leave the door open. This person found themselves unemployed, homeless, and had begun to misuse drugs and alcohol. When they were ready, our link worker took time to listen and identified what mattered to the person. They worked with the individual to identify local support and encourage them to engage with those services. They are now clean from substance misuse, housed, actively participating in their local community and seeking employment. This is one of many stories about the power of social prescribing and enabling people to make positive changes in their lives. Spring is a service for people with medical conditions who would like to make changes to improve their health and enjoyment of life. GPA Spring covers the borough of Northampton and works in partnership to deliver social prescribing across Northamptonshire. The Spring service is easily accessible with referrals from health, social care and voluntary sector organisations. GPA Spring employs the equivalent of 4 full-time equivalent link workers, or 6 link workers in total, and are working with over 270 people. They've received 266 referrals from April through to September. At GPA, we have worked hard to ensure that our teams are working together. This has been due to a significant amount of staff engagement and team building to ensure staff are confident and comfortable working as one larger team. Our personalised care teams channel primary care referrals into our Spring service and collectively referred over 133 patients into the service in the last year. Spring also work in partnership with our GP surgeries to proactively outreach to people with long-term health conditions such as diabetes, chronic pain, COPD and coronary heart disease, delivering one-to-one link work and facilitating peer support groups to meet the needs of our local patient populations. Over time, they've gained a positive reputation within primary care, and GP surgeries are keen to offer their patients access to the Spring service peer groups for long-term conditions in particular. Between April 23 and September 23, the GPA Spring service demonstrated improvements on the journey of change with an average 6-month improvement of 4.63 and an average 12-month improvement of 8.7. Spring has also tracked improvements in self-rated well-being with an average improvement of 4.19 at 6 months and 10.63 at 12 months. This demonstrates that our longer-term service has the opportunity to empower people to engage in significantly more change and greater well-being over a longer period of time. Both of our social prescribing services are working hard and demonstrating they are making a difference to the populations they serve, as demonstrated by the continually positive feedback and awe-inspiring stories shared by our social prescribing teams. Component 5, Supported Self-Management, helps people to build their knowledge, skills, confidence and motivation to manage their own health and care and be more independent. It is particularly helpful for people with long-term conditions. Health coaching is a supported self-management intervention and is part of the NHS long-term plan and commitment to make personalised care business as usual across the health and care system. It guides and prompts people to change their behaviour, make healthier lifestyle choices, become more active in their health and care, and have less need of services. This is important due to the significant staffing and financial challenges facing the NHS and the burden of long-term conditions, which accounts for about 70% of NHS spending. Health coaching has been proposed as a method to help reduce this burden by supporting people to take more responsibility. Patients who possess the skills, confidence and knowledge to manage their own health use services more effectively, resulting in savings of between 8% and 21% of costs. GPA have designed and deliver our new non-clinical health coaching service. The service is designed to provide coaching for those who need help changing health behaviours and works on the lifestyle changes an individual chooses to make. Our team have strong communication skills with the ability to work alongside people to encourage their engagement. All of our staff have been trained through a Personalised Care Institute accredited health coaching programme. This means our health coaches use general, non-directive and directive coaching skills and techniques, insights and processes informed by health psychology and behaviour change science. Our health coaching service has a team of 4 full-time equivalent coaches and a team lead. The coaches cover 13 surgeries across 3 primary care networks. We co-designed the service ensuring it meets the objectives of personalised care and also aligns with the needs of individual surgeries and their populations. The service has been running since January 23 for just over 10 months. The service took 3 months to build momentum and has been running at capacity since May 2023. Coaches could see around 260 patients at any one time. Using outcome measures helps us to track how effective the support has been in equipping the individual to self-manage their condition. After trialling the Wellbeing Star and WENWebs, it was determined that these measures were not specific enough to highlight the health coaching journey. The service now uses MyCall, which is My Concerns and Wellbeing, and will be able to demonstrate outcomes over the coming months. In the absence of an outcome measure, we can remain confident that the service is making an impact through all of the amazing stories and feedback the service is receiving. Our health coaches are now offering group sessions for people with coronary heart disease. With the addition of 2 new health coaches, we are looking forward to expanding this service across the county. We have just embarked on a new project in collaboration with Public Health to address health inequalities for people with COPD. Our 2 new health coaches will be delivering one-to-one sessions in the N4 local area partnership to make healthy lifestyle choices and link them into a comprehensive pathway of holistic support. It is important that we look after the well-being of our hard-working primary care staff as well as the patients they serve. Emily and her team have delivered group health coaching to staff in several of the surgeries they work within. We also provide one-to-one coaching sessions for our own staff. Personal health budgets. Personal health budgets take into consideration what matters to people to ensure their money is used effectively to support improved health and well-being. They can be used for therapy, personal care and equipment to enable people to work on their goals, identified through personalised care and support plans. One of our services, Spring, have access to a Wellbeing Activation Fund. This has enabled people to overcome financial barriers to accessing education, support or equipment, and has also been used to meet gaps in local service provision by setting up new groups. The team have worked hard to ensure that the money is fed back into the third sector, thereby enhancing the sustainability of much valued and needed services. Since April, GPA Spring have made 301 onward referrals to a wide range of organisations across Northampton. They've also set up and run some very successful groups in collaboration with these services, enabling choice by identifying local needs and co-producing new groups with the people they are working with based on what matters to them. A future focus is to enable our wider personalised care services to support individuals to manage their personal health budgets when Northamptonshire is ready to deliver on this agenda. Although there have been challenges embedding these new services and new ways of working into primary care, we've had the benefit of a commissioner that has allowed us the freedom to test and learn. To enable staff to feel part of a bigger picture and support GP services to develop their understanding of the roles and their ability to support primary care, we needed to bring our services together under one umbrella of personalised care. I started my role as Personalised Care Lead in September 22, and my remit was to operationalise the Personalised Care programme of work and line manage our frontline services. My first job was to recruit leads to develop the services and line manage, support and supervise the staff. I now have 4 amazing team leads who are highly motivated, proactive, supportive of their teams and each other, and are driven to further the personalised care agenda. Our teams have grown over the last year. Between us, we've developed, supported, recruited, trained and supervised a team of 36 staff members as of this week. A recent personalised care staff survey identified staff members feel they are able to provide a quality service. The majority of staff also reported they have sufficient training, infrastructure and support, but there are areas for improvement. There has also been significant work by each team lead to define and streamline the scope of role and ensure safe and effective practice. This has been achieved in collaboration with frontline workers by co-designing the service improvements. This has ensured that staff are motivated and proactive in making the required improvements. Ongoing supervision and support are provided in the form of case reviews, one-to-one supervisions, monthly group supervisions and community of practice to ensure staff have the skills, knowledge, confidence and motivation to deliver a safe and effective service. Our Communities of Practice is a monthly forum where personalised care teams across the borough meet to share good practice, problem-solve issues, learn together, network, build a strong sense of identity, support staff wellbeing and build motivation to work together to make a difference to the population we serve. GPA have been running our Communities of Practice for over 2 years and it has grown over this time and is valued by our members. Personalised care is messy and wonderful, and it isn't one size fits all. Inherently, there needs to be flexibility, choice, and experimentation, a balance between uniformity of service delivery and flexibility to meet individual needs. Gathering the data has enabled our teams and service leads to streamline service delivery and demonstrate service efficacy to our stakeholders. Attempting to gather output data for the services has been a huge challenge with much learning along the way. There was a significant amount of engagement and co-production work with staff, and we now have teams who are fully trained and motivated to deliver a quality service and measure and record outcomes on a monthly basis. This work is ongoing, but we have made huge improvements and will continue to do so. We are very proud that our services are able to provide evidence of the great work they are doing in supporting the population of Northampton to better manage their health and well-being. We recognise that working in partnership with our communities is key to success. However, we identified that some of our community services felt disconnected. In response, we set up a community collaborative forum hosted by Broadmead Community Church. It is open to all organisations across the town, whether that be statutory or voluntary, to come together for the benefit of the local people we serve. The forum has evolved over the past year and become a valuable meeting point to discuss issues, share learning and network. Over the last 2 years, GPA have been running our Community Marketplace Forum. This provides an opportunity for community services across the county to present new activities, courses, events and groups. These monthly online sessions have grown in popularity and are attended by a range of different personalised care services from across the county. Attendees include health and wellbeing coaches, our collaborative care team, our social prescribing services, our care coordinators, community development workers, and supporting independence team. We identified that different services across health and public health and social care all work under the remit of personalised care. It became apparent that this was leading to some confusion for our primary care colleagues. We conducted a series of workshops to support different services to understand each other and work more effectively together. Through these workshops, we co-designed the Personalised Care landing page on System 1 to support our primary care colleagues to know who to refer their patients to. We acknowledge the immense strain on the NHS and the significant number of individuals who are on waiting lists. However, we understand that healthcare is also about the psychosocial factors that impact a person's well-being. Our personalised care teams have worked in partnership to provide greater choice for those with long-term conditions on waiting lists through our chronic pain pathway, Healthy Hearts community hubs and COPD project. Our diabetes groups are addressing a much-needed gap and enabling peer support. Our high-intensity healthcare users pathway is helping people to address the psychosocial determinants of their health. And our new cancer care review service offers people with cancer the chance to work on their well-being and improve their quality of life. The feedback and outcomes are positive. We are making a difference to the health and well-being of our citizens. This is a whistle-stop tour of all the work we've been implementing and have developed over the last 3 years under the Personalised Care Agenda, and we've learned so much through that time. As a team, we have built our knowledge, skills, expertise, and our passion for personalised care over the last 3 years. We are ready to develop and cascade our learning across the county and to work in partnership to further the personalised care agenda in Northamptonshire. Thank you for listening.